Hi, I'm Deborah,
And I'm Lawrence.
and in this video we're going to discuss and cover the difference between anxiety disorder and panic disorder and anxiety attacks and panic attacks. That's all we're going over in this video, but we're going to...
We have some more things related to this topic that we're going to talk about in future videos, though.
Yeah, so for instance, treatment, diagnosis. We'll probably do a video just about anxiety and just about panic disorder. So right away I had a little bit of a problem saying anxiety video, because the thing is though, although a lot of people will use anxiety and panic interchangeably,
they're different.
Yeah, and anxiety disorder and panic disorder interchangeably.
They're
the
different.
Thing is that anxiety disorder actually is an umbrella term.
Yeah, a more general term used to describe more than one thing.
Yeah, some of the disorders that are under that umbrella of anxiety disorder are generalized anxiety disorder, social anxiety disorder, panic disorders, and phobias. Sometimes when people are talking about panic disorder or a panic attack, they're really talking about an anxiety attack. And then what they're really talking about, because anxiety disorder isn't its own disorder, they're probably talking about generalized anxiety disorder. Mm-hmm. So in this video, when we talk about anxiety disorder versus panic disorder, we'll be talking about generalized anxiety disorder versus panic disorder. So one of the big differences between the two of them is that, or probably the biggest difference, is that generalized anxiety disorder can usually be linked to something that someone is concerned about, a specific thing. Not always, but usually.
Yeah, I mean, I especially struggled with a lot of anxiety surrounding my future, especially college, and that plagued me for the last 3 years of my high school education. I was constantly worrying about what was next and if I was going to succeed. I didn't have high hopes. I was always worried about, am I going to be able to do this? Am I going to fail spectacularly? I was also worried about jobs. And then,
chances are that most people have something to be anxious about.
Yeah.
But
I was going to add one more that a lot of people are probably suffering from in the past couple of years is anxiety about COVID.
Everyone, pretty much, let's face it, nowadays has something like that. So it's either grades, getting into a good college, a situation at work, a relationship. There's always something pretty much that we have that has the potential to make us anxious.
Yeah.
So
there's a multitude of things. So
what it comes down to, though, is for some people it doesn't affect them physically. I have met people like that where it does not affect them physically. They're not going to have physical symptoms. They're not going to be anxious. They're not going to have trouble breathing. They're not going to have their heart beating. So there are some probably genetic differences between people who deal with anxiety and do not have it affect them physically and people who do. As I said, we're going to go more into generalized anxiety disorder. We'll do a video about it. But that's really the difference. And then for some people that turns into anxiety attacks. So again, as far as the attacks, people use those, panic attack and anxiety attack interchangeably. And again, it's understandable why, because there really hasn't been much of a delineation. The other problem is anxiety attack isn't actually a medical term. There is no term. I'm not sure if that means that medicine doesn't officially recognize that people can have anxiety attacks. Okay, so there are several differences between anxiety attacks and panic attacks, although their symptoms are very similar. So some of the symptoms that they share are shortness of breath, fear, a feeling of fear, a pounding or racing heart, chest pain, being lightheaded, dizziness, and irrational thoughts. Anxiety attacks generally have a specific trigger. Generally have something you can point to. Like the closest I remember having an anxiety attack recently was we were driving you and you were late for something, and I started having trouble breathing, like right away, because it was something we didn't want you to be late for. So it was clear that was the trigger. Now, this can, with anxiety attacks, stuff can be building for days or weeks before it actually happens. Now, panic attacks, most of the time, there is no specific trigger. Almost all the time, there's no trigger. And when people say they come out of nowhere, they really do, because they can't be connected to anything in particular that the person has been thinking about or experiencing. So another difference is that anxiety attacks will generally build up over time. They can build up over days, weeks. And so, usually someone can see them coming because you've been having maybe mild symptoms for a few days or something, and then all of a sudden it morphs into, much more serious, much more serious form. Panic attacks don't have any buildup except for maybe a few minutes in which the person who's having about to have a panic attack, they can have a change in their breathing and their heart rate. They may not notice it, so that may seem like it comes up like this, like the panic attack is just from 1 second to the next. But luckily, in a way, these changes do occur, because that's how service dogs sometimes help people with panic attacks.
Yeah.
Is they'll be trained to notice the heart rate increase and the breathing change, and they will alert the person that they are going to have a panic attack, and that way the person can get somewhere safe, sit down somewhere, lay down, whatever. So you'll probably notice for this section we were wearing different clothes. What happened is when we started editing the video, we realized that we really need to clarify some things about the differences. So in terms of symptoms, for instance, anxiety attacks can be mild, moderate, or severe symptoms. Panic attacks are pretty much all the symptoms are severe every single time. So here's the really confusing part. Partly because panic attacks are still not well known. Panic attacks seemingly do not have triggers in the same way that with anxiety attacks, you can generally point to something and say, I've been stressed about this, whatever. It's, or I've been stressed about these things. That doesn't mean
there isn't one.
Right. We don't know what they are. They do have probable causes. So, for instance, genetics, some medications, substance abuse. I mean, I saw a list of like 10 different things. But again, we're dealing with the unknown. So there probably are causes, but not triggers in quite the same way that anxiety attacks have them. Now, what happens is that your brain tells your body to go into the fight or flight response. We don't know why that happens. So yes, that's kind of like a trigger, but we don't know yet why that starts happening. And obviously, again, I was thinking, is it kind of funny if the brain's doing that? Because the last things you can do when you're having a panic attack is either fight or flight, because you're generally like not able to do a whole lot. So it's obviously a completely screwed up mechanism that the brain is triggering off. Okay, so the differences that we've talked about so far with anxiety attacks and panic attacks is the severity of the symptoms, and the lack of a clear trigger with panic attacks, the way that you can generally find one with anxiety attacks. The last difference is the length of time. Anxiety attacks, as we said, first of all, can build up over a period of time, and but they also tend to last longer. They literally can go on for days, as opposed to a panic attack, which generally lasts anywhere from a few seconds to 10 minutes. I mean, that's pretty much the range. Now, we're not talking about the symptoms or the after effects, for instance, like derealization, depersonalization. Okay, those can go on for hours. But this is the actual attack itself. Is much briefer than an anxiety attack is. Hopefully that has helped to clarify things. As I said, we're going to expand on this.
We're going to do more
because it's
videos.
such a huge topic that there's no way we could cram it even into 2 or 3 videos probably. So we weren't going to try to do it into one video.
Yeah. So, in any case, if you found this video helpful, give it a like. If you didn't, give it a dislike. If you'd like to say anything at all, leave in the form of a comment. And if you'd like to see more content like this, go ahead and subscribe. But, in any case, we hope that you have a nice day.
Take care.